In this video you would learn about pelvis. The pelvis is the bony structure in the lower part of the spine that connects the vertebral column with the femurs, thigh bones. It plays a crucial role in supporting the spine and transferring the weight of the upper body to the lower limbs. The pelvis is divided into two main parts: the false pelvis and the true pelvis. The maternal pelvis is adapted to the biomechanics of childbirth. The shape of the pelvis can vary among individuals, and there are different classifications based on pelvic shapes, such as gynecoid, android, anthropoid, and platypoloid. The gynecoid pelvis is considered the most favorable for childbirth. During labor, the baby's head must navigate through the maternal pelvis. The size and shape of the pelvis can influence the ease or difficulty of labor. Healthcare providers often assess the pelvis to determine if it can accommodate the passage of the baby during childbirth. This assessment is crucial in understanding the potential challenges a woman may face during labor and delivery. The true pelvis is further divided into three types based on its shape, which can affect childbirth. These types are commonly known as pelvic shapes or pelvic types. The four main types are: 1. Gynecoid pelvis. This is considered the most favorable type for childbirth. The gynecoid pelvis is characterized by a round or slightly oval shape. The inlet is round, and the pelvic cavity is spacious. This type is more common in women and is associated with a higher likelihood of a smooth and uncomplicated delivery. 2. Android pelvis. The android pelvis is more heart-shaped or triangular. It is more common in men than in women. This type of pelvis is less favorable for childbirth, and women with android pelvis may have a higher risk of complications during labor. 3. Anthropoid pelvis. The anthropoid pelvis has an oval shape, with a greater anteroposterior diameter. It is more common in non-human primates but can be found in some human populations. While it is not as favorable as the gynecoid pelvis for childbirth, it is generally considered more favorable than the android pelvis. 4. Platypoloid pelvis. The platypoloid pelvis is characterized by a wide transverse diameter and a short anteroposterior diameter. It is less common and less favorable for childbirth. Women with a platypoloid pelvis may have a higher risk of obstructed labor. It's important to note that many individuals have variations or combinations of these pelvic types, and there is considerable diversity in pelvic anatomy. Pelvic types are just one factor among many that can influence the dynamics of childbirth. The assessment of pelvic types is primarily of interest in obstetrics and can be used to predict potential challenges during labor and delivery. The maternal pelvis is a bony structure that forms part of the maternal pelvis, which is essential for the passage of the baby during childbirth. The maternal pelvis consists of several bones that are grouped into two main parts: the false pelvis and the true pelvis. 1. False pelvis. The false pelvis is located above the pelvic brim and is not directly involved in childbirth. It supports the abdominal organs and forms the superior region of the pelvic cavity. 2. True pelvis. The true pelvis is the portion of the maternal pelvis that is relevant to childbirth. It is further divided into three parts: the inlet, midpelvis or cavity, and outlet. Inlet. The pelvic inlet is the upper opening of the true pelvis. It is bordered by the pelvic brim, which is formed by the sacral promontory, the iliopectineal line, and the pubic symphyses. Midpelvis or cavity. This is the space between the inlet and outlet. It consists of the pelvic sidewalls and the pelvic floor. The pelvic floor is formed by muscles and connective tissue and plays a crucial role in supporting the pelvic organs. Outlet. The pelvic outlet is the lower opening of the true pelvis. It is defined by the pubic arch, the ischial tuberosities, and the tip of the coccyx. The pelvis has several diameters, which are important in obstetrics and anatomy. Some of the key diameters of the pelvis include: 1. Conjugate diameter. This is the most important diameter in obstetrics. It refers to the distance from the promontory of the sacrum to the inner surface of the pubic symphyses. The diagonal conjugate is an external measurement that estimates the conjugate diameter and is more easily measured during a physical examination. 2. True, or obstetrical, conjugate diameter. This is the shortest anteroposterior diameter of the pelvic inlet. It represents the narrowest part through which the fetal head must pass during childbirth. 3. Transverse diameter. This is the distance between the widest points of the pelvic inlet. It is important in determining the shape of the pelvic inlet. 4. Oblique diameter. This is the distance between the sacroiliac joint of one side to the iliopectineal eminence of the opposite side. These diameters are essential considerations in obstetrics to assess the adequacy of the pelvic dimensions for childbirth. Each woman's pelvis is unique, and these measurements can help healthcare professionals evaluate the potential challenges or ease of the childbirth process. Additionally, the pelvic structure is also important in orthopedics, anatomy, and various medical disciplines.